Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. So Patrick, thanks for joining us on Here for Good, the Inside Edition.
Thank you. Thanks for having me.
So how long have you been working at Virtua?
I've been with Virtua for about 5 years now.
For 5 years. So you and I aren't spring chickens, so I would assume that this is not your first career path. Is this sort of a second career for you?
It is. I worked in the real estate business for over 40 years. Some years ago, my wife, who's also works at Virtua, has been here for about 15 years. She suggested that I would come to Virtua, and she thinks it would have been a good fit for me.
Has that journey proven to be true?
She was right on target. It was perfect. I started in food services for a year, and then I moved over to patient transport, and I've enjoyed it every day.
So you started in food service prior to patient transport.
That is correct.
Correct? What is it about patient transport that really let you know that that was a place that you should be?
Well, I like meeting people. I'm outgoing myself, and I feel like I'm doing something good when I'm helping with the patients and meeting them and trying to make them feel at ease. They're going through a rough time, so if I can do anything to make their life easier, that's a plus right there.
Can you share any interactions that you've had with patients that just sort of stood out for you?
So I like to tell patients jokes to make them feel at ease. I kind of get a feel for the patient if they're in the mood to laugh a little bit. When I pick up a patient and I introduce myself, I tell them, don't lie to the x-ray technicians. They can see right through you.
So clearly it works. You know, you're one of the first individuals where I actually had multiple people that recommend that you and I sit down and talk. So clearly you're doing something right.
Well, I'm enjoying it. And I look at a patient too, and it's not just the patient. I see the family members there, and they want to know that their family member is getting taken care of. So if I put the family at ease also, just by, with joking around and just to make them feel good, again, make them laugh for a moment, and it helps.
You know, a lot of people think when they think about careers in healthcare, automatically want to go to doctors and nurses and other allied health professionals. But a short story, my son, who is also in healthcare administration, but back when he was in college, I encouraged him to get a job as a patient transporter at one of the hospitals because I felt he would get a true perspective of what the patient felt like when they were in one of the most vulnerable situations. I thought it would give him a chance to connect with people in a very different way. And so for you, I mean, you just mentioned your ability to connect with patients when they're most vulnerable. What can you speak about how important it is for every colleague to sort of contribute to creating a patient care experience that's acceptable, which you said is so important in terms of how you're able to make a patient feel, but maybe share with our audience the importance of everybody, not just those that are in direct patient care, contributing to the patient experience.
I feel it's important because I get patients who are going for various testing, and I just want them to know that they're getting the best of care no matter where they go. So I tell them, I said, that if I'm taking them to the various locations, I said, look, this group is wonderful. They'll take good care of you, and I'll be back to get you, and we'll get you back in, make sure you're safe and comfortable, and you'll have everything right at your fingertips. And I just try to make them feel like they're the most important person at that time.
So it's not just taking them from one place to another. It's really being a part of their healthcare journey.
And that's what I try to do. Even when I go up on the floors and pick up another patient, I have a moment, I'll stop in just to say hello. It's just a, hey, how you doing? I hope you're feeling better. And they're pretty excited. Hey, I'm getting out of here in a day or two. And I try to joke with them. I said, listen, when you're ready, we're not going to take you down in a wheelchair. We're going to do piggyback. Just jump on it, and I'll take you down. And it just makes them laugh for a moment.
But you know, I think that's great for you to be able to help to relax patients.
I want them to feel like they're going to get the best of care, and then with me, they're going to get hopefully a little more.
You mentioned your wife, Tracy.
Yes.
Works here. Tell me about y'all days off. What do you do when you're not transporting patients and making them feel comfortable?
I have a granddaughter. She's 6 years old, and we spend quite a bit of time with her and taking her out to the park or just shopping and spending time with her. We always enjoy seeing her grow up. She's 6 years old right now, and we're just having a ball.
What about your fellow colleagues that you work with? Describe for me just sort of the environment and just sort of the collegiality that you have amongst your other colleagues that do what you do.
It's a great combination. There's people my age, I'm in my 60s, and there's a lot of kids who are going to school while they're doing their job. I just like the group that comes in here. We show them our experience from a work standpoint, and they got a lot of energy, and they're looking forward to their future.
So what would you like for me and other colleagues throughout Virtua to know about the service that the patient transport team provide? What is it that you think we could all benefit from knowing about the work that you and your colleagues do?
Well, I think it's important knowing that we're going to take care of the patient, get them from whatever location they're at to where they need to be for testing, but also that the patients are going to be relaxed and taken care of, and basically when they get to where they're going to, that they're going to feel that they're going to get the best of care. And I think that's important. And that's what I always stress to patients I'm moving, that no matter where they're going to go, everyone's going to be right there for them. It may not be as funny as me, but they're still going to get the best of care.
And that's great to know, and because you are a critical part of the care team.
Well, I appreciate
it. And I think hopefully your other colleagues realize that they too are a critical part of the care team. I think more than anything that they should know that you represent the team well. The work that you do, the work that the entire patient transport team does is so critically important to what we do here. And quite often you are, in many cases, the first and the last face that many of our patients will see, and you leave a lasting impression. So on behalf of the entire organization, thank you for being here for good. Thank you for everything that you do for our patients. And it's truly been my pleasure to have you on this edition of Here for Good.
Well, thank you.
Once again, it's been a great opportunity to speak with Patrick about the exciting work that he and the rest of his colleagues do. Tune in the future for another episode of Here for Good, the Inside Edition.